Hello, my name is Amita Bey, and today I will present our project entitled Minimizing Bias in Obstetrics, a Virtual Training Curriculum. All authors are listed, and this project was sponsored in part by a grant from the Tennessee Maternal Mortality Committee. When seeking obstetric care, women from underrepresented racial and ethnic minority groups are particularly vulnerable to biases that can impact timely delivery and quality of care. For example, Indigenous and Black women are 2 to 3 times as likely to die from a pregnancy-related cause as white women. Additionally, when looking at specific health outcomes in obstetrics and gynecology, we know that significant disparities exist for racial and ethnic minority women. Examples include preterm birth, eclampsia, preeclampsia, and HELLP syndrome, unintended pregnancies, and breast and cervical cancer deaths, to name a few. To address this, unconscious bias training is recommended by various governing bodies, including the American College of Obstetrics and Gynecology and the State of Tennessee Maternal Mortality Committee, to make providers more aware of the biases that can affect clinical decision-making. We sought to develop and pilot a virtual unconscious bias maternal mortality curriculum to empower obstetric providers to understand the science of unconscious bias and recognize racial and ethnic disparities in obstetric outcomes. Upon workshop completion, participants were expected to be able to identify the role of bias in decision-making, recognize racial and ethnic disparities in maternal mortality, and identify equitable strategies to improve patient-provider communication for patients with preeclampsia. We developed a virtual 90-minute workshop for obstetric providers to explore the role of bias in decision-making, review racial and ethnic disparities in maternal mortality, and engage in strategies to mitigate bias in the care of women with preeclampsia. We used pre- and post-test surveys to assess participants' change in knowledge. Our curriculum included didactic and interactive elements such as defining conscious and unconscious bias, exploring strategies to recognize and mitigate bias using the PAUSE model, didactic videos, and small group discussion. A total of 12 workshops were conducted at 5 hospital sites across Middle Tennessee. 278 obstetric faculty, nurses, trainees, and staff participated. When comparing pre-test to post-test survey responses, significantly more respondents understood that bias is a natural function of the human brain after completing the workshop. A significantly higher percentage of post-workshop survey respondents were able to accurately recognize the PAUSE model as a framework for mitigating bias. Although not statistically significant, more post-survey respondents were able to accurately recognize that our identity is shaped by our culture, group characteristics, individual personality, and the institutions we belong to. Regarding the bar graph on the right, 79% of survey respondents agreed that Black women with a college education had a higher maternal mortality rate compared to white women with a similar level of education. There were no statistically significant differences, however, between pre- and post-test survey responses for this question. Overall, 97% of post-workshop respondents indicated that they will adopt or modify a strategy when communicating with patients from different cultures, backgrounds, or languages as a result of participating in this training. Finally, during each workshop, small breakout groups identified successes, challenges, and new ideas designed to improve patient-provider communication and minimize bias during the management of patients with preeclampsia at their institution. In conclusion, we successfully designed and piloted a virtual unconscious bias maternal mortality workshop for obstetric providers within Middle Tennessee. Post-workshop survey responses confirm participants intend to change practice and improve knowledge regarding unconscious bias maternal mortality. We plan to expand our curriculum to include training on microaggressions, bystander education, cultural competence, and cultural humility. Given that we did not see a statistically significant improvement in knowledge of racial disparities in maternal mortality, we plan to offer supplemental workshops designed to emphasize racial and ethnic disparities regarding maternal morbidity and mortality. Thank you.